Doctors are starting to notice this strange connection. Frozen shoulder and one-sided pain may be your brain sending an early warning. You probably think shoulder pain is just part of getting older. A sore joint, sleeping wrong, maybe bad posture, and most of the time, it is. But when the stiffness is only on one side, comes out of nowhere, and doesn't respond to stretching, movement, or rest, it could be something more. In fact, researchers are starting to uncover a link between sudden shoulder stiffness and early-stage neurological conditions, including Parkinson's disease and subtle nerve disruption in the brain. Before tremors, memory changes, or speech issues show up, the body often gives quieter, weirder warnings, and frozen shoulder might be one of them. In this video, we're going to explore why this happens, who's most at risk, and how to tell the difference between normal wear and tear and a symptom that deserves a closer look. Because sometimes the smallest, most familiar pain is your body trying to tell you something far more important. Before we continue, if you're over 50 and value science-backed insights into health and wellness, be sure to subscribe for the latest research discoveries. So how could something as simple as shoulder stiffness have anything to do with your brain? Let's start with a condition called adhesive capsulitis, also known as frozen shoulder. It happens when the tissues around your shoulder joint thicken and tighten, making it painful and hard to move. Most people assume it's just age, posture, or overuse. But here's where it gets interesting. In some cases, frozen shoulder develops without any injury at all. No fall, no lifting, no strain. It just appears. That's when neurologists pay attention. Studies have found that some people who develop frozen shoulder out of nowhere may be showing early signs of neurological changes, especially in cases where the stiffness appears on just one side. In fact, frozen shoulder is sometimes reported months or even years before other classic symptoms of Parkinson's disease show up. It can be one of the first signs of motor control disruption, when the brain stops sending clean signals to certain muscles. But it's not just Parkinson's. One-sided shoulder stiffness can also be a subtle result of microstrokes, cervical spine compression, or other issues affecting the nerves that connect your brain to your arm. These changes don't always cause dramatic symptoms at first, just quiet stiffness, reduced range of motion, or pain that doesn't follow the usual patterns. Another clue: if the stiffness is accompanied by hand weakness, tremors, or fine motor difficulty, like trouble with buttons, zippers, or writing, the shoulder issue might just be the tip of the iceberg. Even the way your shoulder sits at rest can be a signal. A slumped or rotated shoulder on one side, paired with grip strength loss, might point to neuromuscular imbalance. And if your posture is starting to shift unevenly, especially without an obvious cause, your brain could be the one sending mixed signals. That doesn't mean every shoulder issue is serious, not at all. But when stiffness shows up without injury, sticks around longer than expected, and only affects one side, it's worth paying attention. Coming up next, we'll walk through the red flags to look for and how to know when your shoulder pain deserves a deeper conversation with your doctor. So how do you know if your shoulder pain is just muscle fatigue or something worth a closer look? Start with a few simple questions. Did the stiffness begin gradually, or did it come out of nowhere? Is it isolated to one side, and does it persist even after rest or stretching? Does the shoulder feel weaker, or like it's not responding the same as it used to? Are you noticing any changes in your hand or arm on that same side, like reduced grip strength, tremors, or numbness? If you're nodding yes to any of these, your body might be trying to get your attention. Let's go deeper. A shoulder that suddenly becomes stiff, sore, or hard to move, especially without injury, can sometimes be a result of neuromuscular changes, not just joint wear and tear. And when those changes are happening on just one side, it becomes more important to pay attention. Here are a few specific red flags to watch for. Frozen shoulder that develops with no clear cause. One-sided stiffness that affects how you walk, move, or carry weight. A shoulder that's progressively losing mobility over time. Tingling or numbness radiating from the shoulder into the hand. Visible changes in posture, like one shoulder hanging lower than the other. Reduced strength when lifting or gripping objects on the same side. Any shaking or tremor in the hand while the shoulder feels stiff, these symptoms might suggest early-stage issues with your central nervous system, such as Parkinson's disease, which often begins on one side with subtle rigidity, minor strokes or transient ischemic attacks, TIAs that affect mobility, spinal nerve compression from cervical disc problems directed by the brain's motor signals. Most people dismiss this kind of stiffness as aging or strain. But here's the truth. When your shoulder changes without explanation and doesn't improve with the usual fixes, that's when it's worth looking deeper. So what should you do? First, don't panic. These symptoms don't mean something serious is guaranteed, but they do mean you should pay closer attention. Keep track of when the stiffness happens. Notice if it's affecting other parts of the same side, like your grip, arm strength, or balance. And most importantly, bring it up with your doctor. They may suggest a neurological exam, a physical therapy assessment, or even imaging to rule out deeper causes. That early step could save you from a delayed diagnosis later. The best part? You're already ahead because you're aware. You're paying attention to your body, and that's the first step to protecting your health. Noticing these patterns early gives you more options, better outcomes, and more control over your future. Because sometimes the smallest, quietest symptoms are the ones that matter most. And a stiff shoulder could be your brain's way of whispering, look a little closer.